And you may just talk to us. This direction is good. And I would like you to clap one time in your hands.
When I'm ready?
Yes, when you are ready, you can clap. It's because of the audio, because I'm recording image and sound.
Okay.
And when I have a clap, I see when the noise hits.
The thing is covered, huh? That's a microphone.
Oh yeah, you can. Yeah, you don't. Yeah, you can put it like
better.
this. This is good.
Okay.
Yeah.
Wonderful. Yeah. Can you clap once in your hand?
To indicate that I'm ready.
Just yeah. Just clap once.
Okay.
Yeah.
Yeah, that's okay.
Ja, thank you. Oké, mag gewoon vragen stellen.
Okay. Could you tell what is your function here in Assembly 8?
Yeah. Here I work as the project coordinator and I also assist the programs director. Yeah. And on CIMAV, I'm the project coordinator for the project.
Okay.
Yeah.
And what do you do as a project coordinator? What are your tasks? And
Yeah, I coordinate all the activities that has to do with the project. And I have field officers that I work with. They are on the field and I am here. Sometimes I do go to the field to have first-hand information of the reports that I receive from the field officers.
oh yeah, I see.
Yeah.
And could you?
So basically, I do the reporting to on project activities.
And could you maybe repeat for the camera just your name and your function? So I am, and my function is.
Yeah, my name is Jafaratu Mahama, and I am a project coordinator here at Assembly 8. Yeah.
Okay. And can you tell something about what kind of projects are implemented within this CIMAVI project?
Within the CIMAVI project is the reproductive, where this is not the first time Assembly 8 is working with CIMAVI. We started with a reproductive health project, and the project ended. Then we've now started with this reproductive health specifically for the youth. The first one was on reproductive health for women in the rural communities, and this one is specifically for the youth, and it's about comprehensive sexuality education for the youth and then their rights to sexuality.
And can you shortly explain how you do that, comprehensive sexuality education? How does the project function? What kind of activities do you do?
Yeah, we do that through a series of activities. For Assembly 8, we use social drama to provide education on sexual reproductive health rights for the youth. We also use Reflex, which is an adult literacy model that we use for both the youth and the adults. Then we also have radio discussions. We have resource persons or experts to talk about sexual reproductive health on the radio, and then we play back that for community members to listen to. Sometimes we have phone-in sessions for people to ask questions, and then those questions will be answered. Yeah. Then we also use peer educators to provide to educate their fellow youth on their sexuality.
And what would be at the end the objective that you want to reach with by doing all these activities?
Yeah, to improve knowledge, one, on sexuality for the youth, and also access to sexual reproductive health services by the youth.
Okay, and why is it important to improve knowledge and to create access?
Reproductive health is a very key area of concern for especially people up north, and the youth is a major target group. So that's why we need to provide more information about their sexuality to enable them access those services that are available. Mostly the services are there, but the people are not aware of them. They are not even aware of much of their sexuality, and so when they have problems, they don't know where to go to. And so that's where we have reproductive health problems. So if we provide them information and then help them to access the services that are available for them, we would in the end improve the reproductive health situation in the northern region. Yeah.
And could you say why it is important to have this project in this specific region? So what are the problems of the youth?
Yeah, here our culture is such that such issues.
Oh, you're.
Oh, no problem, no problem.
Okay.
Just stop for a minute. One more time in your hands. Thank you. And we can continue.
We were talking about the problems.
Yeah, you were asking why I think that project is very important over here. Yeah, one, there's high rates of maternal mortality over here and infant mortality. And secondly, the culture here is such that such issues are not discussed with the youth. So their only opportunity to have information on their sexuality is basically through friends, and such information might not be entirely correct. Yeah, it's like parents are unable to talk to their children about the issues of sex or concerning their development, and so the youth are denied information or correct information about their sexuality. So this project basically is to provide information on their sexuality and also to increase access, since they are not aware of their sexuality, and where to access services when they need them. So this project is to address those issues, especially here when parents or guardians find it difficult providing information to them. And in schools, yes, they are supposed to provide, such teachers are supposed to provide such information. The extent to which they do that is not that much, and then majority of the youth over here are not in school, so it's difficult for them to access such information. So one of the target groups for this project is out of school youth, those who are not in school. In Ghana here, the northern region has the lowest rates of literacy. People don't go to school that much. Parents prefer to have their children follow their footsteps, and basically that is farming. And so they have no opportunity to have such information. And the other issue is that people have access to such information through the television, the radio, newspapers, and then other social media. And that can be gotten from the urban centers. For rural parts of the country, such access is very limited. Most communities don't have electricity. It's right now that they are promoting that. And even with that, it's not so much. It's still very limited. Because there's no electricity, they don't have access to the television, even mobile phones. And since most of them cannot read and write, they can't have access to the print media to have such information. The internet and other places that other youth can easily access information. These people don't have that. So this project is to address those gaps.
Yeah. And can you tell what the consequences?
Can you just give a short summary about what you just told, because of all the sound surrounding us? And can you put the left side of your thing, not on the furry animal, like this is wonderful. Yeah.
So as I was saying, the youth in the communities that we work with have limited access to information as compared to their counterparts in the urban sectors. They don't have access to the television, the radio, the print media, internet, and so on. And these are the very same people who don't have the opportunity to receive that information from their parents, because here it's not accepted for parents to talk to their children about their sexuality. So they don't have access to such information. Yeah, and so this project is to provide information through other channels to these youth, so that they have knowledge about their sexuality and also how to access services concerning their sexuality.
And what are the consequences of this lack of knowledge? Like before the project started, what could you see happening here as a consequence of lacking knowledge?
Yeah, because it's just the left side because it was all.
As I indicated earlier on, that there's high mortality, high infant mortality, maternal mortality, and then infant mortality, and then the fact that the young people were not accessing health, their reproductive health rights properly, because they didn't know where to go for such services, and so there was cases of unsafe abortion and unwanted increased rates of unwanted pregnancies. You find a young girl who is not married, she's not working, and she's walking about with a pregnancy. She's not sure of her own future and that of the child. And so if people are educated on these issues, they are able to prevent unwanted abortion, unwanted pregnancies, and then also to seek for proper abortion. Yeah.
Okay.
And also in the communities that we work in, we have what we call early or forced marriages. There's been a situation that we've been battling with for some time now. Very young children, young girls are forced into marriages, and she's so innocent. She doesn't know anything about her reproductive situation. She gets married, she gets pregnant. She doesn't even know who to talk to, because at that level she's so innocent and shy. She doesn't want to tell anybody about what she's going through. And during delivery, she finds it difficult. That's where we have that instance of deaths during deliveries. So if these people are all targeted and then given information, once the girl is informed about her sexuality, the need to prevent unwanted pregnancies and how to prevent them, then she's able to prevent those pregnancies, and she's able to plan her life properly. Yeah.
And what changes do you see happening now in the communities?
Yeah, the fact that more young men and women are involved in the project means that they are having more access to the information. There is increased number of antenatal attendance from the health facilities that we work in. It means that the information that we are providing on the need for them to access those antenatal facilities is going down well. The fact that people are patronizing condoms more means that people are planning their lives well to ensure that they don't have unwanted pregnancies. Yeah.
And how are the project activities at first received by the community? How does that go, that process?
Yeah, the issue of sexuality itself, it's a very sacred one and not openly discussed. People don't feel comfortable talking about their sexuality openly, and so it wasn't easy just moving in there to educate people on their sexuality, bringing up the topic itself. So we had to find channels of introducing that topic to them. And one of those channels that has been very useful has been social drama. Sometimes when you have very sensitive issues and you dramatize and you have people have fun with that topic, have people laugh about it, then they feel more comfortable talking about it and then coming up with their problems, and you are able to talk to them more. Then the other thing is the reflex circles that we have in these communities. Because they are an existing group, or they are a group, they feel comfortable sharing information about these things. And so whatever they learn at the reflex sessions, they also go back home and share it with their family and friends. And that way, the information is shared easily.
Yeah, something else. What is the role of the health worker in this process?
We use Stimuli Aid works in close collaboration with the Ghana Health Service, because they are the experts when it comes to the issue of health. And so when we have trainings, we use them. We use them for their expertise. And most of them already work in these communities, so it wouldn't be proper working in isolation. So we work in collaboration with these people, work together with them. When we have trainings, we use them as resource persons, and they come to work. Then we share reports. They have their reports. It's true then that we know there's an increase in the number of referrals, the number of antenatal people accessing antenatal care, because that's where that's where they go to do it. And so when you need information on these things, that's where you get them. So they are more or less our resource persons, and they are very key to this particular project.
Yeah. And how is the relationship between people from the Zimavi project and the health workers?
Yeah, we since we have the same aim, that is improve access and then knowledge on sexuality for these community members. So we find it easier working together with them. And so we have a very good relationship with them. When they go to the community and they have any information that they think we should know, then they let us know. When we go there, we find something that we think they should know, we also let them know. And then they also, on the project, when we have our review meetings, they are part of it, so that they know what's happening on the project. They have first-hand information on whatever is happening on the project.
And these health workers are paid by the government, I think?
Yes, they are paid by government.
Can you clap your hands for me then?
God.
Yeah. It's funny, eh? Thank you, wonderful. Proper clap. Okay, we can continue.
Okay, we can continue. We were talking about the government.
Yeah.
So you were explaining about the health workers and the common goal. In what other ways does the project involve the government?
Since it has to do with matters of policy, since it has to do with ensuring that people access services that are supposed to be provided by the government. You can't go and educate the people on their rights, tell them that there are these things you need to access when those things are not available. And so working with the government, we know that these are the kind of services that are available for the people to access. Then we go to the people and then let them know that these are the services that are available for you to access.
And do you think that the services that are available are sufficient?
No, that's far from true. It's barely sufficient for them. For instance, in the Central Gonja district that we work in, there's only one chip compound that is functioning. That is even barely functioning. It's just been set up. That's at one bomb, and all communities in the district have to go to Kosovo for the district capital, Dupe, to access health facilities. And most of these communities are very far away from the districts. And so imagine a pregnant woman having to travel, maybe when she's in labor, having to be carried from her community. And we know that the road networks in these parts are very poor, and the pregnant woman being carried from that community up to the district to access in order to access health care. It's really a bad situation. So we are still working with these people. We are still working with governments and to ensure that these facilities are provided and made accessible to these community members. The government is also keen on providing these things, but mostly, though the government workers also work directly with the communities, but researched information on the needs of these people mostly comes from NGOs, non-governmental organizations. So from our work we get information, we share with the government, and they know the real situation on the ground of what to do. So we are always working together with them.
May I ask something? Are they also open if you think about social accountability? Like if you work closely together with the government, but you have a lot of knowledge and tips, is there a lot of interaction going on?
Yes, there's a lot of interaction, especially with this particular district that we are working with. Mostly you are invited to sit and call their meetings, and you have an opportunity to contribute and then make suggestions. Likewise, they are also involved in project activities, as I said, in our trainings and our weekly meetings where we plan activities and so on, and they make their inputs for us to work on. Yeah.
Okay.
And you have been working with this project since almost a year.
Yes.
Is there any changes you see on the level of the government regarding budget or policy or involvement?
Not directly. Currently, I can't really say that it's as a result of this project. But yes, there's improvements in government policies towards those areas. But I can't specifically say that it's as a result of this project, though the project activities might have contributed to that.
And in this project, how do you empower the community, especially the young people?
We believe that information is power. Once you have the information, for instance, you know that you have the right to have health facilities in your community. So now it's up to the community members to come together and then demand for these rights. And we provide that, we create that platform for them to have the interaction with the duty bearers, to present their problems to them and see how far these duty bearers can address those issues. So yes, they are gaining their voices with knowledge and information that they are being provided with, and we are positive that very soon those things would be provided to them. They can no longer be cheated by these people because they know that the community members now know their rights, and they are now demanding for these rights. So yes, it's helping. Information has given them power, and they are using that power to demand their rights.
That sounds quite strong. And regarding the services, I heard that they are not really youth-friendly.
Yes.
So what are you doing to make them more youth-friendly? And what does that mean?
Our intention was to provide youth-friendly corners so that even if the youth, it's really they are really not comfortable going in there to seek for information or access any health facility, because a young girl who wants to have an abortion doesn't feel comfortable walking in there to talk to anybody at all. So the idea was to have youth corners where like they know that this person is working with the youth and knows how to deal with problems associated with the youth. So when she walks in, she goes directly to talk to this person. But that has not fully taken place because of the lack of facilities in the areas that we work in. So what we have done is to train health personnel on youth-friendly services, how to receive the youth when they come with their problems and how to support them and not let them go without coming back again.
And did you see if that works? Do you see
it's working because most of those who have gone there have gone there again. It's like the person has been able to go to talk to a health person about his or her problems, and the fact that the person can go there again means that the person had been friendly to him or her. And so the repeated access to these services is an indication that it's really working. And more youth are accessing it, more youth are going to their clinics to talk to them about their health problems. And so yes, it's really working. It's just about how they interact with the youth. It either pushes them away or pulls them to them. And so they were taught how to receive the youth in a friendly manner to make them comfortable to access those services.
One little pause.
every time 8 minutes and then
Then I restart. I think
restart needs to be done.
Yes. Oh.
Oh, they get louder each time. Okay, well, just a few questions left. If you look back at the past year, what are the results, the main results that you see?
For me, when you go to the community and you have many youth coming to you, like you have a program, you call them and they all come out, it's an indication that it's working. They are not shying away from our activities and they are now fully or actively involved in our activities. For instance, peer education sessions are going on very well. People sit and listen to their peer educators, and the fact that the condoms get finished very early is an indication that they are purchasing it, they are using it, and very soon I'm sure we'll see the results of that. So for me, the situation has really changed. Having them sit together to talk easily about their issues concerning their sexuality alone, it's a giant step, because formerly you wouldn't have a youth talking about his or her sexuality openly, but now that they can sit together and then discuss issues concerning their sexuality, it's a big step forward. I think the fact that we see them accessing these services, especially at the main health facility, is something that is very positive for us.
Yeah, it sounds quite good. And is there still a challenge that you are meeting?
Yeah.
Maybe many, but can you mention one that's still difficult within the project?
Yes, the females are still, as compared to the males, it's still a challenge getting them to fully participate because of this perception that young girls involved in those things are promiscuous. And so that's a stigma, or that's something, that's an impression misconception that we are trying to clear. And yes, they are picking up. We have young women who are part of the project as peer educators, as reflect circle participants, and they participate effectively. But we have wanted to have more. When you go to the reflect circles, you realize that we'll have more males than females, and so that is now our main target: getting more females into our activities, because they are the most affected by these sexuality problems, and so they should be participating more than even the men. It's going to take some time to bring about that change, because they've been born into that society where culture sees the woman to be the very silent one, the very dormant one. She's not supposed to speak out in public. She's not even supposed to talk about issues concerning her sexuality outside. And so it's going to take time to bring about that change, to have them participate more in our activities.
And how to go about it? How would you make them participate more? By personal contact, or?
Yeah, through personal contact mostly.
Yeah, just keeping inviting them.
Yes, you don't have to lose hope. You just have to continue working with them. It's easier for those in school, but those who are out of school, it's still a bit of a challenge. But we are working towards it. We are targeting them more.
So time is of essence here. You think it will time is of essence. It will grow more and more because the awareness is rising.
Yes, the awareness is rising, and with time, I'm sure they will, when they see the impact of these activities on the lives of those who are participating in it, I'm very sure that they would also be encouraged to participate. When they see that these people have a well-planned life, they are able to deal with unwanted pregnancies without any complications, and they are even able to prevent these unwanted pregnancies. They plan their lives very effectively. I'm sure they will be encouraged to take part in it. And we are also working through community leaders. Mostly when we want to bring change, especially when it has to do with the culture. The community leaders are supposed to be the custodians of the culture. If there's going to be any change to the culture of the people, it should be through the community leaders and opinion leaders. And we've targeted them, we are working through them, and very soon we know that when there's any change, we are working together with them. They can change the culture, they can ensure that these people are not stigmatized. They are not seen as people who are promiscuous, but people who are taking challenges in life, people who are taking control over their own lives. And so they should serve as role models instead of being stigmatized by others. And we also have young women who have had certain experiences talk to their colleagues. Yes. If someone has suffered from unsafe abortion, we target that person and then use her to be talking to her colleagues about how to prevent that situation. She has been through it. She doesn't want her colleagues to go through it, and then this is how she thinks they can avoid that situation. So I'm sure with time it's also going to have its impact. They begin to talk, to speak out, they begin to participate effectively in our projects.
That makes me think of other cultural barriers that sometimes prevent women or young girls to go to checkups, for example. Can you tell something about the cultural issues that are here and how you work to change it?
Yeah, for a pregnant woman, you are not supposed to let anybody know that you're pregnant until we call something paparado. It's until a sister-in-law or a mother-in-law comes out to announce that you are pregnant. You are not supposed to, in any situation, indicate that you are pregnant. and this happens around the 4th to 6th month of pregnancy. So it means that the pregnant woman that cannot access antenatal during that before that custom is practiced. She would have to wait until it's been announced to the whole family that she's pregnant before she can let anybody know. So she can't be seen at the antenatal accessing healthcare because it shows that she's pregnant, and that's against the tradition. So this has always been something that has prevented women from accessing antenatal health care. It's been a very huge barrier. So women have not been able to access health care during this periods. So that's one of the things that we are looking at, telling them that the health of the mother and the child is at stake if she's not allowed to attend antenatal health care. So sometimes we can arrange for the person to be secretly accessing the health care until she's announced. That's in situations where she's completely prohibited from doing that. But some husbands understand, and that's where you have to target the men as well as the women, because here is the man who is the final say in the household. He would have to give the woman the permission to access, to go to the health facility. If he says no, she can't go. So even if you provide that information to the woman and you don't target the man, it would not work, because if the man says, even though the woman knows it's good for her, she can't go in for it because the husband would not allow it. So we also target men as well, and we even now have men accompanying their wives to the health facilities to access antenatal health care.
Yeah.
And as we also use TBAs, that's the traditional birth attendants. They are very instrumental when it comes to reproductive health of women. And so when they know the importance of antenatal care, when the woman comes, when she identifies a pregnant woman, then she begins to educate her on the need to access health care from the very early stages in pre-pregnancy.
And something different. Do you remember how the situation was when you grew up? Did your parents speak with you about sexuality, or did you get it at school, or not at all?
I have been fortunate enough to have both parents being educated, and they were both teachers. My mom a home scientist, and basically that has been her duty. And so yeah, I had the opportunity of being spoken to about my sexuality at that very early stage. But I've had colleagues who I had to share my information with because their parents wouldn't give them that kind of information. And the extent to which the information I gave them was correct was another issue, because not only from me, maybe from other colleagues, they sourced for information on their sexuality, which might not be accurate. Yeah, for me personally, I was fortunate enough to have both parents educated. They saw the need to provide that information to me at that very early stage. Yeah.
And what did you do as an education? Like, did you study health or I don't know, French?
No, I studied for my first degree. I studied English and history. Then for my second degree, I studied innovation and communication, and that is directly related to my work. Yeah.
Het over accurate knowledge.
Mm-hmm.
En op dat moment wilde ik vragen van wat zijn dan misunderstandings? Misunderstandings.
Oh ja,
Oké.
even opzommen.
Maar ik weet niet of jullie...
We have a few more questions. Yeah.
Yeah.
we talked about, you talked about having accurate knowledge
Yeah.
on their sexuality.
Yes.
And so Doreen was wondering, what are the misconceptions that they have?
Yes, and there were a lot of misconceptions, especially with regards to maybe family planning, for instance. It was assumed that, or the information was that when you take the pills, when you take the contraceptives, it prevents you from having children for life. That's a misconception that needed to be cleared, because it prevented many women from accessing family planning services. So it was an area that we needed to let them know that it's not true. There's a period you can plan when to have children and when not to have children, so that you can space your children the way you want. Yeah. So that was one of the misconceptions that we needed to clear.
And can you think of any other misconceptions?
Yes, for instance, thinking that talking about your sexuality is being promiscuous. It's about knowing who you are, knowing your sexuality, and being able to plan your life very well. And so that's belief that when someone is talking about sex, someone who is talking about his or her sexuality, it's a bad person. It's someone who is always indulging in promiscuity. Yeah, we needed to let them know that this issue is an issue about rights. It's something that affects your life, whether you like it or not. So it's better you have information about it, and then you can plan it properly, than to think that you can hide. Most young people are adventurous, they are promiscuous, they can get themselves involved in sexual activities in secret without talking about it. And so if you make, and they can encounter problems. Sometimes young women can have problems of infections and other things, and because she can't openly talk about it, she suffers quietly, because she feels that when she talks about it, people will think that she's promiscuous, people will think that she's engaged in extra premarital sex or something. So she keeps quiet, and then she suffers silently. The girl has gotten herself pregnant. She doesn't know that she can access safe abortion at the health facility. So she follows friends, and she's not able to abort the pregnancy properly, and there are complications afterwards. So providing information, dispelling those notions and misconceptions about sexuality, that talking about your sexuality means you are promiscuous, accessing, for instance, using condom shows that you're a bad person, you are promiscuous. No, it's just about someone who is planning his or her life properly. So these are the kind of misconceptions that we've had to clear, to let them know that it's proper for you to use condom than to have an unwanted pregnancy. It's better for you to talk about your sexual problems openly and have solutions and proper solutions to them than suffer in silence and so on. So these are the kind of misconceptions that we needed to talk to them about.
Any other?
No. I'm
I
gonna
think,
press stop.
Heb je last
Dag
van
3, interview 1. Ja, die mag wel weg.
Laat me dwal.
Als hij zijn mond houdt.
Oh, zijn kip.
Ja, go.
Okay. You may ask if she can clap one time her hands in front of her.
Ai
face
ni
one
wala
time.
ngo ka pahale. Pahama.
Thank you.
Nada na ya.
Okay.
Ai yel nyu ku yelen ken ya.
You can just speak to where you can go. We can.
Okay.
Ai dun ma ka yara. Kama manka yatira. Okay.
Can she tell us her name, how old she is, and where she lives, how the village is called?
Ayule, Aidan Yule, Ayuma, Netenshe, Ambion, or the Yule, Yenka, and Boy. Ayule.
Yule Bamun, a Bamun Sarfunya, Ambia Wambo.
Ayuma.
Fishing out point.
I am Bamun Selfu. My husband is Selfu. And then I'm in the Wambon community and I am 27 years old.
Bamuno?
Bamuno, B-A-M-A-M-U-N-U.
N-U.
Salifu.
Salifu.
Yeah,
okay.
S-A-L-I-F-U.
Okay.
Rama, I'm not sure. So this way, let me right follow. Aha. Okay.
Can she tell us about the problems with sexuality and pregnancy that were here in the village before the project?
Na pahambo puna kuna yongo de nang dabai. Yela pam bien zan chang pakane do polo bibule pule be shabu yihre puhe be so nang de puka dwaka pi den kar dale galse pam halka tumango te kanak a pahambo puna.
Dwakar chuma da jana ba ma dan nan kanin ne sun ma a shirta nan ma yi ma dwakar kilan kam jibe pulba milanka.
There used to be stillbirth because of lack of clinics even at the district capital. So later on when they had the clinics at the district capital and then the education and awareness started, it has actually reduced. And then also teenage pregnancy was also one of those things. And then this time it has reduced because they now have clinics.
Did she say all that?
Yes, that's what she just
said. Okay, because it's good to just translate what she is
Definitely.
saying. So
I'm doing direct translation.
Okay, great. Yeah,
I don't want to add anything.
No. Okay, very good, very good. Okay, so teenage pregnancies and stillbirth.
Okay.
Was it for women also difficult? Were there difficulties when giving birth?
Were there difficulties? Is it now?
How was it for before?
Okay.
How was it for women to give birth?
Na tulama ha pagabo dwabo na pumpon wulan daniel na pumpon de mal sochi bi de ka sochi na tulama ha.
Manya ka pumpon pagabo dwama de mal sochi zantete.
Wula so.
Tama ne yara mal sochi ma. Pumpon wese yulan kana kulan wese mente be hwa ne bazan a chan dwate. Ai chan a shirti ma na anya ka na wonta zo sombe ka ne sin ma ka ba dwasa yi bi ma.
First, it used to be that a woman can labor for almost a week without even knowing where to go. But this time is better because they don't now have clinics and then they have people that encourages them to go for antenatal, especially when they are laboring, they will push you to go to the clinic. So this time is better. And certain time you go to the hospital and maybe the nurses too would help.
Yeah. And what activities of Simli does she participate in?
So similar to mama ban kanata non de lama ato piade ne.
Piara.
De den san na kabe.
Ndira papu num to asbuye to apulu.
Actually, I'm part of it and I'm also one of the health committee members.
And can she explain us what she is doing as a health committee member?
I'm be papu no mapulo ka be pa mapulo ma bokito nanda. Be fila dena kito dira.
We
talk about antenatal and then clinic attendance.
ka bɛ zaŋa chaŋ ti deeri kaɣali o ti sabila maana na nyura bɛ mi din yɛn ti be bi maa shɛm bi yin paɣa ŋun mali puu
from taking concoctions and then this black medicine and then the herbs, because the herbs, there are no prescriptions on them. So it's better you go to the hospital where they have prescription than taking herbs and herbs. So normally they also discuss that.
Yeah. And how does she spread this information?
So yin jin ma ngoma an yersam ma wula ka to yara taba be den yan pasha ba.
Te ko jina ngo be kama manan tabe she na to twasir ba kama de te mai puhre to ne te zo zambo. Yuna te dala fezo.
At this stage, she still have peers because she's having friends and other people. And when they meet at a gathering and then they discuss and those issues are out there, then she advises them as what to do because they have learned from her.
Is she also a member of the Reflect group?
Ben Karen the young Shukurma ne Abirapone. Yes.
Can she tell us what people are member of her group?
Anto Timbanum Lebe Jima Pune Pavana Daboko. We have men and women, and among the men and women, we have girls and then we have women.
Okay.
So that means two categories, women and girls.
Yeah, mixed. And what
topics do they talk about?
Yeah.
Kamayi pe be tension ma atane amfan dem be lahba din karle ma jande san chang parman do polo ne papo non polo den san kat to dir fira.
Mata te dir amfan pan san chang papo non ne dab ma ye to ama.
We benefit from the SRHR issues because Bokama wula
kama tension mo ka so paai ma puwa ko kore duk wo zang chang zahambune tension ka banyere nan wona so paai ma puwa to so wo zang chang.
Like today, being a circle member, they were there to perform the drama and they were there to do the resource mapping, and people in the community who are not part of them have seen it themselves. So now if you have a pregnant woman at home, it means you have taken some information there and you may use it.
And what changes has she seen since the start of the Reflect circles in her community?
There are changes. Then Sunny.
Kami kol glisambana ka yara shile shara an wa mara ta'dwar ci haka cete.
Now the number of antenatal attendants has actually increased, and then the diseases also decrease, and then sanitation too has expanded. You can see that where we are sitting is clean, and this they do it normally, either monthly or every 2 months. So actually there are changes when they started with the health issues.
Yeah. So she mentioned sanitation and
antenatal number increase, and then diseases of children reduce.
Can she say what kind of diseases?
Bibima dwatama ne dwarbono bonda to mosraba.
Tranyar kara sirkanyar mu'sraba.
Cholera.
Paja.
Malaria.
Tanda mu'sata. Dormini nan kaba yina ntata jiran sabro nan katalwarma ta taye kachete.
And actually some time ago they supplied us with mosquito nets. So this has actually decreased the number of malaria cases.
And regarding to SRHR issues, what is the biggest change that she sees?
Ka babana dabiya to apolozan kana bunguri she natin nan shel zuma din kale kunya kare takazan chan te pagdo so to under ma polo.
Bun karata wusha mamani tan chan te pagdo to an man ma fulo ma da to ka pagdo to an pa wesi o gbato wura ne bazan chan ashe.
He's saying that the biggest change is that they gave training to the TBS, and this time they are doing more.
Take 6. Wanneer we hebben? Take 6. She can clap one more time. Yeah, wonderful. You can go.
Can we?
How does she feel?
So no pumpon ayane wula karna ndisa do wuhan pumpon yitahara nirba shitna yidi bil ha doserba na la de the least information that they get about a woman laboring is the referral.
Kama tan kana wadina tan shinike wadina dinna bade non yusum kadi kul bolma kar ko yunnom pelfu ko be dogara kan kiko be nan ko su.
Yeah, they're saying that this time they do more of referral than delivery.
And do the women always go, or is it happening that they are not allowed?
Ne karara and the sound so to have a to tahro baby zaksara yidanama. That in her community no, but they are aware of her experience. While they call her.
Ye ti yanka ka ko ni surana di nya kan tong na ha an ka lu ma en sa ke ke yu kan na ya pang kan ha sa ke ke da ka bi na tam ai kyang kar tin nan bela ko do ra ka ko yina te yele
Certain times when they gave them that training, they gave them some first aid boxes that include gloves and then cotton and then the first aid issues in it. So normally she takes her first aid box that Simile gave them, then that is what she takes there first. So if it is due that time, then she puts on her gloves and then she delivers.
Yeah.
But this time there's improvement because they didn't have such things. But this time in their box they have soap, they have gloves, they have cotton.
And how does she feel about the change, not doing that much deliveries anymore, but more referrals?
No, so I will have drosser. Come but drosser man and a drosser man, then later mala anfan.
But do how one drum between drosser.
Yet then later malin anfan and your
drum yellow to come. And the two while she no shilman. Captain Dila no dilla in town.
That it was very painful when you're going to deliver a lady and then the child would die, or maybe the lady would die like the child. But this time we have made their work easier and more successful than before, because they'll just say go to the clinic. When you go to the clinic, they'll save you. But when you stay with me and then you die, you may not find it easy at all for a long time. So this time it makes them more comfortable than before. So they are comfortable with it.
Yeah.
Kama yang nadira. On doon yela between dira. Ama what doon you could try to dira. Yan bambang hat shelma. Became captain Persia Kuma. Kakiber chef tap shares. A million.
Ama yi doga yi suro kom. Yenen suro kom.
No could da bien kira besoin au kiama.
Bison okuna.
Ka besoin au kuna. Ka ka man yon bon cambien zan kuna yan na man tutun tutun.
Now.
Ka yele te paro koma. Ma bi ay ko to bien yela na kuro ya kaza no tam ya kaza no ndo ay. Ko te sul da ka ko yela na. Ka jaba nan konta. Ba bi ko lan zan ngo ma ta mutu ma so kana. Da na pan to shin mutu zo ka bajiya. Na yela na pasura yan da kan diro di ma ngira ma ta. Mungkin yang kira-kira, tentang di mana beli. Kami ikut belum nak. Biar aku pun mama yang suka kan haka.
That one of her duties is to bath the baby. So as for that one, it's not the duty of the clinic. So when she gives birth, then they come back to the community, does the bathing. And then whatever benefits she was already going to benefit from the delivery, still the same thing. Because they give her due.
Yeah.
So there's no problem at all with it, and she's comfortable with it.
That's good. And the clinic is still far away, there's no transportation. Does she or the community involve the government to ask for closer hospital or more
Kazon
transportation?
ye yana ka shipti kar wagma yi to yar gwamnati no son ya shipti be yi yar so ke yar so no son ya shipti banan ke yar
so da mati yi ko lagante ata kunante yele ya hay yene kama ti kuna
ko yulum mana
ya ti kuna tan yele mi dob ma ka ba tuhma lagr songa kama pa so ti yen do kare kema ka ba sango kyam ba mi na ba tuhar songa ba tuhar songa ma mandin ko nyela mpeha ka bang yene do ma na ko to do ko ba ma wo ma de yen no shi kya ba sango ko yele mu to ma ka ba sango kyam ka ko li yana diga bel muni ya wa ne sango ba kyam ma ba kyam ka ti yen do ta ne ma yen tam ya ka sa ko yen do la tam ma ni ko do ka ba ma ni ko ma
They were trying to establish a fund, set up a fund, a community fund, so that they will be doing some little contribution, so that in case of setting, they can go to the district capital, get a taxi or a motorcade to do that. But the people are not even willing to do it. But she's not aware if the men are also working hard to get the transport, but he's not aware that they've informed any government official. She's not aware.
Okay. Yeah.
She is not aware.
Okay. Well, for me that's...
mij ook.
Yeah.
Ja,
Wil jij nog wat weten?
Nee, no, I'm good.
Nou, ze heeft 8 kinderen, hè?
Ja.
Dus ik graag zou willen hoe haar eigen dochters of kleindochters bevallen.
Hoe haar kleindochters bevallen.
Ja, ze zou willen dat ze in de zwangerschap...
En zou ik ook vragen wat voor informatie ze hem gegeven heeft?
Ja.
Okay. One final question is about what kind of education she gives to her own children regarding pregnancy and delivery, and how she would wish her children to give birth.
Nenda amal behe ponse biane wula kale yarba zan cham dogam polo be pagane do polo yi kam abihma be dabya wula ka ti har na ban doga su na paga do so dogande do siga be be dogma shite
zakono ba na so kam na ne zero shemso ma ne ye dorola hat dogam ne yenen do shemma dogam be non ma kama yin shin san shi han kan do da farga
ko yelma inda fare
sawa kan ya o ya pa nda idea no yang tin yela go no dogam da mel men yin pan la go ne yelo yana miki o kana
so ka wula ka yara behe zan cham dogam do pulato dirba fila
ma bana ba kul da balo ngiya se so man bi mun bilan bien ne
hal ban kul da ba
do sahe yewa
that currently she was saying that she gave birth to 8 children, and she was even disabled when she gave birth to those 8 children, and she never delivered at the hospital. It was at home, but when she started laboring, it would not take her 30 minutes. So it was the grandmother of a peer educator who was delivering them. So all the 8 children, but for now, all her daughters are married. It's only the granddaughters that are with her. And the only issue is that she always tells them that they should try and space their birth, spacing. So the children are there and they are doing that, and she's okay with that. When they say dostase, it means family planning, and it includes spacing. That she only gave 8 because she was disabled. She should have given more. So
how old do you think she is? She said maybe 100.
She's old.
Yeah.
She's old. You start.
Okay, I start to.
Just wait a second.
Can you clap one time?
That's good. Okay,
Yes, we can start.
Yeah.
Ayule na yitin she na yuma na tum da tunshel.
Yule Honorable Jabondi Abdul Gafaro, Yila Wambana, Kanya Assemblyman Zanto Wambon, Electoral Area, Kalanya Peer Educator, Zanto Wambaman de Tonquanqua, Yela Yum Petanayi.
I am Abdul Gafar G. Jabuni. I am a peer educator and an assemblyman, and I'm 32 years old.
Can you ask him to look to you?
Na yule mayera, kache camera to.
Okay, so we will start first with the numbers because afterwards
Ne
the TV
pompote
can hear.
yule number ma. Katibi wana
Yeah?
chang. Okay.
Can he first explain what he is writing down? What kind of information?
Ne pompo peer educator nyami mala records book. Boka recorder, boka writer.
To, man, no sabro shanyela, pardon, so Toranama, Bendosi be power, and sabro me, and nana bukuna, Cassava Danshele, one dora, Jima and Zanan bukuna. To a date and nanka yet to shame more, come up with swimming, parsomi, and Dorcar and Boscaraji, and was on with Yashifting, and Sableme, and Zana, and Zante, Cavazan Mele, Cavabancama, Tokorebi, Parma Dorban.
What he normally records is on the activities of the TBAs, deliverance, referrals, and then the rest. For instance, when a lady is laboring, they will inform him and then he will do the recording. And certain time he attaches a note to the TBA and then they will send it as an assemblyman and peer educator so that they will see the concern. So with that regard, it helps a lot. So what normally he records is the date, the day of birth, the date, and then the sex, the name of the mother, the name of the house, and that helps a lot because that can be used for their birth certificates.
Yeah. Is it okay?
Yeah.
Okay. And can he say how many births there were in 2013 and how many this year?
2013, Honorable Gafaro Bihala Kapadoso Torandamada Dorsa Young.
Brad Dorse a big piscina,
25 children. Kapava, in all they were 25, but for now he cannot segregate between the sex.
Okay.
Male and
Can you ask him to give this information more in a full sentence?
Ne Allah madazaha yunoma punete yongo paramana ra dora be pishina anu kabra dora karle sagayene lab yelle
yunmo pune yo parbane and dorbe bazaha yahya be pihnina we
2013.
to 2013 2014
No, we were only 2013.
2013, okay.
I am a
You
big
will
pishina.
I don't know if he knows, otherwise maybe we have to count. Or...
So currently he's having two different information, 13 and 14. So he was bringing the total. So I don't know whether we should work with the total or we should work with 13.
I would like to know the difference
between
the 2 years. So
2013, I am a big pishina la cabra. 25 in 2013. So give us full sentence. Cover break it. You know, pulling one bongo brad go parabanda do behmara yasla be pishinami. So that one sentence. Okay, teacher.
You know, pulling Paramanda do brad do be pishinano.
One bon. Okay. 2013, 25 children.
Okay.
And how many have been born in 2014?
Ka 2014 you know pulling bihala kabadwa.
Be piyona
64.
64, okay.
Yeah, 64.
But that's more than in 2013.
Yes,
so they started
25 against
counting
64.
late,
Yeah.
or they started late.
So 2013 ma ida ba pil dang la kalbo yo. They started mid of the year. That was after they were given the trainings.
Yeah. Okay. And when he looks at the referrals, how many referrals are there?
But so turn the man who are captain shifting to daughter. Nearby la cabo.
Nirwana kawo.
You know, the referrals of what is it, antenatal or when they are laboring?
When they're laboring to the hospital.
Nearby and daughter shifting,
Nirwana.
You know, this year 4 people gave birth. They go one. Okay, this year 4 people gave birth.
In the hospital?
In the hospital.
Okay.
I'm going to do something difficult. Can you ask him to tell the whole story? So about the first year, 1/2 year was 24, 25 people, then it was 60.
Okay.
And then from this amount, there's a certain number in hospitals so much, and home is so much, if he can try.
So, to born in one sentence. I am film kama, 2013, young one bongo, parabon wanda dry. Abangla, Buminara dry, parabon wanda, changa shifting, Kango dry. Then 2014, parabon wanda dry, Ngora dry, Kango dry shifting. Amali in the car to boss from the tumpon to chana shift to Gary young. I'm in a boss, my young woman number of poor. So I to check at the bank, Kama, Kale Pay, more than my cut the bank so that I can hear one sentence. One, you start from 2013 to the one bongo, Pabon, one that drawing woman that draw shift in the Kango drawing. Through 2014, one bongo that draw this total at this at clinic, this at home. So in that order, one sentence. So be interrupted. Can we go ahead?
Yes, sir.
Okay.
You know, from the power Pishinan in that 2013. Power Pishinan in that draw one bong. That I was also chancellor polo. You know me, power pay you na cover drawer, and na cover drawer. To enter a bit bupune nearby na covers and chancellor.
Okay. He's saying that in 2013 they gave birth to 25 children.
Yeah,
and then this year 64. And he said when they gave birth, some of them were not well, so they have to admit them. So they admitted 4 of the children to the hospital.
Can you ask him what he thinks, because he's from the younger generation also, what the biggest problems the young people are facing?
Na pahamo puna na chimbo mpasara youth problem den ka professor be ka atulta na na bazan chante parlement da popolo
ante ye mangale nettoyer na chimbo mpama ye twam rosra bie wasan ante ane ye twam rosra bie wasan ma ana min to jia ka to gumne na chimbo ma sheba Borne bobo parba ma swangsma gbalma di to kabasan be parba shewa borne benye tun shanga tun kala zote mo kabo zorchen kaya yo ye to mo sramba basa.
He's saying that as a community leader and then a peer educator, if you look at the youth, lack of jobs certain times brings some of these problems, especially teenage pregnancy and then the rest. And then the rural-urban migration too comes from the same problems. So these are some of the problems that are in the community. Rural-urban migration, and then certain times because they sit idle without work, without job, they create more problems, especially the sexual aspects.
Yeah. I think because would the TBA woman want to leave? Or does she want to stay for the interview?
Teacher.
Ja, ik denk wil je nog veel?
Nou, ja, die peer educator wil ik even interviewen. Ja. Maar zij kan wel gaan.
Oh ja.
Alleen misschien wel eventjes interviewen, maar dan kan zij met Geert mee.
Raman is riding.
Kan ci jama ba.
Na kana ko maga nang mala photo teacher na kana ke ngombo.
Maar ik moet even goed vertalen hebben.
The driver?
Driver, he's over there. Where we did the first interview. Let's go.
Okay, we were talking about problems. So you mentioned youth without a job. What are the problems regarding sexuality and pregnancy here?
Kapumpo was on Tipumende, Bibe Pulme, Ulanyare, Parliament Dagwara.
The Bella, example, now a woman was also into the Pium. But was on the
Karabatar Canon, the Tawabi Tara.
So until Halamuna, I know Kunya Pia it get a ma. Until the boy Gondomazam Kana. Ye simulate aid in that song to Kondo until that Kana, the Nama. So the Nama zone, Punlazo, Nirwanapulu, and Kanam Nantaba.
You saying that being a peer educator, he does his job in such a way that he talks to other friends and then peers, especially regarding the sex issues, and then the education he does, and then the awareness creation too he does. But the problem is that they started even the protection. So when he collected the condoms from Similar Aid Office, actually somewhere along the line they got some shortages, so they are still requesting for more condoms.
Does he have is it like a business for him, something that he can earn money with?
Karate and condoms might be Yes, I think so.
Can he explain how it works?
But then that Niradi Tamshel, and I will quite and I could love me and Nirva. In yellow, come a dinner to a nanka, a guam, catch it or yiran babu. Then in Yakama, ace it duro. Then Yancheka, the two tar catch a papu, carpuna yiran. So until Hanera could lamba, Kayeva, Yaba tomato shell, condom shell, and Tiampayanga, Punkanat.
Yeah, what he did was that you know, as a human being, you have to set the trap first. So when they first gave him those condoms, he came and then gathered them, told them about STIs and STDs, and then told them about protection and then teenage pregnancy and how they can protect themselves. So, and told them that he's having some condoms with him. Immediately after the education, they chased him out and everything got finished. So first he gave it out freely, and then later they started with a fee.
And how much is it, the fee?
50 pesos.
And can he explain how much he can keep for himself and how much for Cindy?
Nitonya kama di kwa ko puneto mprogala buta kanzan sheli chang simle 8
It's based on percentage. So you take 30% out of 100% and then send the 70 back for more condoms. So that he takes the 30%.
Okay. Can you say that in one sentence how much it is?
Jim Sora Biala, Arapam, Pamtop Sora, ne Anto Yellow one center, he can't dig condoms, Master Sanikana, in Quarlam, Palampishinano, me Qualia, Malamongo, Palampishinano, me Qualia, and Pupu Cobo Vara Peta, Kazan Pisho Point, Sora Carnia one sentence.
Each young simile 8 into dear condom now. Unquire like one pishinano, no. In your quahana, Campule, and Zang, on Vapu, Buta, Kazan Piso Poemo, Peta Kazan Piso Poemo, and Zanjante, simile 8.
And why doesn't he get any new condoms when they are running out?
Neka wula ka bin yar condom paladitin nara.
ye male di nan ka lagri kana lagma ye kana nkuto nye shele.
Yeah, saying that for now, certain times sell it out and then the money is not there ready. So he has to wait and then later on he send the money and take more. The boy,
tam shele shone to kana banta san wo fobla un swanga kama warna ka lagre wo mi jen wo paganan non plus pas wo disons yon so prend la so nto ngiro to runguna di ma ayte ngel ma ka zangtuma na
certain times there are some emergency cases. So maybe you want to have sex with your woman and the woman will say no unless condom. And you are eager to do that thing. You rush and say, oh, some woman, this is my program. But the money is not ready now and I cannot wait. They will say, okay, you take it and go and use it. Later on, you balance me. Or maybe you have emergency, your girlfriend coming from somewhere and say, I just want to pass by. And you don't have money and you want to do that thing.
Yeah.
You rush and then borrow. Then
so you're still waiting for money. Yeah. Okay.
So there are emergency cases.
Yeah. What does he think is the role of male when he would be older? What will be his role when his wife is pregnant?
Zankwa nirma pulo. So asumi nyeshe zankwa nirma pulo the two nkpangswa ka butu che kama bori yiran bobo. Do pa bori yiran to che ka the two nan ka anye duro. So the two nan to lerwa banks.
As an elder of a community, you pass through stages, your youthful ages, so you have a lot of experience to give to the youth. So when he's older, he knows definitely that he pass on the experience to them, especially unsafe abortion, sex protection before sex and then the rest. He has experience and he went through some training, so that the knowledge that he passed through that.
Yeah. And would he, in what way would he help his woman when she is pregnant?
I so about my
on pound you my foot, into how unbenung for wallet, into in the zone of Tiana should
he leads the wife to the clinic.
So Kawata Zahandro. Canton Bora, Ben Yeman and Bobinshire, I should tell a man and Benshatu good.
And for instance, certain times they will go to the clinics and then whatever information they give to them, they will not let you know as a man. So if you follow them, you hear and then you see.
Yeah.
So that what they want you to do as a man, you do it.
Yeah. And what is he doing as a community representative when he goes to the assembly?
Now, Changa Assembly as assemblyman, what do you do? They work at Yerbas and Changa community man, especially on SRHR issues.
In Changa Assembly, into in Panam can Yerba and Tongman and the Bourbon Changa. The Yemusra can Zanga Terwa. Then in Yakama, the cash shooting. Conjusion. The shukuru, them jesio. Nzangle and Swanaba, you will come among our men, the boss, the year from Shanga, them young community man.
No matter what he does, is that when he goes to the assembly, what they learn from us, and then the training that they get from us, and then the gathering, when they gather at a community level, and then they get the action points, like talking about clinic, talking about school furniture and the rest. As an assemblyman, definitely that is what he discusses with the district assembly, so that they will support them with the clinic or schools.
How were their reactions? Can you give some examples?
So I Yerbama will hear the reaction. Be example,
so ni Yerba one, Tiha, ni Yelba,
That you can see that they have given them a new school block. It was through the discussions with them. Currently, you've seen the accommodation there. It was through this discussion that they gave the teachers accommodation.
Wait a bit, it's chaos here. Stop.
So now yelba about chiefs compound be katanga be clinic kan yelba mama assembly wula kap yele san chambe ko be wula ki nonda anto ezan pa mama ne man shin ni me den masham kana borsos
ai yelba be yelane ben kana ta shonte be mi be kanna so katan bantan wa pune yina te ye ne te yina ma ntim miela ashibituma nzan zet mama tan yan vitande kam mi kapele
that through the information given to them by Assembly and this project, they have sent these issues to the Assembly. Always there are a lot of promises. We are coming, we will do it, we are looking into it, there are no funds. But he as an assemblyman and community members came out with this action point. And currently they are contributing from house to house. Take name.
Huh? No. Take name.
They are contributing from house to house?
They are given 8 minutes.
Oh.
Yes, please.
Clap.
Yes, please.
Government officials can. Mumangule can.
DC can. This can.
So Kele Kultika Tanzania in your records. So I said they should go when we are passing by, we stop at her community and then we say hello and then go there over there.
Okay.
So they can go now.
Yeah.
Tomba your some kitchen, got a pie na. So so let's go. The district chief executive visited them several times. That is the district chief executive.
Okay.
The one in charge of that. Pasoro, your samamba. De la hayya to kucham.
And personally, for him, what activity from the Simli project does he like most to participate
I'm
in?
the similar project man and then Sankali work from that Piaden. Karananda and Yaksen Kai, similar project more from Wamangura, the Malson Simpa.
This project ma de vie pamzantuma.
So Bumbo in particular.
Intiana could get the neck into banks and tama poon and the concert sabta, cover deal of Yangama, the Nomanias and Pam. Cantulan banks were come a bidora gandam de Villa, cover deal ma de vie pamzantuma, cover 2 terrible mancatiera and Georgian one AC Durama.
With the similar project, we have a common ground that we need to share ideas and work with it, and that is the reflection. And that has helped us to know how to keep our environment clean, and sanitation has improved, and we also discuss issues of SRHR at that level. So I like it because they bring us together.
Yeah. And what is his opinion about the training that he got?
And I know trainer shall as peer educator. Wula Kanya, the strong.
The strong mappa. The mating man the company, and tell young Kukana, young Yukunyaka, Sambana, India Sahara. The Chimaka, Bisoku Baduru, Yiran. I could you let the Noman Yasampa. Capzella.
There are some peer educators. I see that this time the community are now together because of the information that they have been related. When you look around, you not see grass and like you go to other communities. They make sure that if they come together, clean the whole community. Then you can see, for instance, for example, yourself, look at around and you see it's clean. That these are all part of the training that he got from that, just to help the community.
Yeah. And could he tell us what the training was about that he got?
Peer education, what was it?
Oh, but I went to te mangs te nang buna ne sabta ye to abra wuhtele kalan wuhti kama pagman du ni to mbuwa tawshem den to nang tam shele ka pagm tam she pagsu na to bi duona ka duwa ba mi no o shele dione ka ko deso kan da kuna te yelle karda nang nirma nyaxtum pam do ma ti mi ya kama du kon ko so ne to lu pagna ko belagam to ma nira in yelle tiba pagma gbara ban ya kama pagso ne to bi duona ko yelo yira na ko muno za
But among the training, actually they learned a lot. But something was so interesting that at the training they told them that certain times it's not only the man who would like to have sex with your wife, but certain times your wife too may want you to have sex with her. But here you cannot tell your husband, I want to have sex with you. But they taught them at that level that you can do that as a woman. So they taught them how to do it and then the approach. So when he came back and mentioned it, they were very happy. So this time he's sure some of the women have tried it. They now demand.
Yeah. Can you tell us if he's married and how many women he has?
One wife.
Yeah. Nice.
Wat denk je?
Ik denk goed.
How many children?
Not
yet.
Not yet.
Okay.
He's expecting.
Take 2, interview met dame. Dag 3, yes. She can start. Thank you.
Can she go ahead?
Yes.
Tony Alpahamba Pune, Tumama, and Kanana, Bossishama, Tida, and Mapolo, Taraba Biani. Katabana Bianma, Taradin can 20 Yidan and Ma Taya.
The Iran and Ma, but Taya. The man never tire, ma. So, Babylon, the bar of Parabis or Cabina, the Madi Poir. Kaduma Boara. Aman Duma, twice away and yellow kid twice. One is not chang ashit and ten on Drassasi. One a dollar, one drum nakita usra. Kadima Pankina and Drapos. Maraja.
She's saying that there are a lot of changes. For instance, they used to give birth not with distance. Maybe every year or every 2 years you have another child. This time they are spacing. And the spacing too is because the men have changed. Now it's just the agreement between the woman and the man that even though the child is still small, but I would like to have sex with you. So what can we do? Then they decide either to go for family planning, contraceptives, or they agree on using condom. So this time they discuss with the men, and then there's the men who even initiate. Because want to have sex, then definitely you have to negotiate.
Okay.
So there are changes. That was why she was laughing.
Yeah. And if a man says no to his woman when she is laboring, no, you cannot go to the clinic, just as in the drama. What do women do? What can they do?
Dinnan kamar wakati wasra kai dan won jimana she kagalu tima ku chan clinic biya shifte. Pamalo yan non shambe wulan tuna pana.
Amala.
A woman you have something.
Don't man amala assembly man. Antu chan ta pu. Ka yulo nyam demba mahma so haza. Kan yel kan yiran do be satma. Kana yuni ni wannan ka alwatin na kanta je da so kan yan kana ta yira ka kana ta zan hankal fa wo zan ma can ashi.
They have opinion leaders in their community, especially she mentioned the assemblyman. So if something happen, what you can do is that you talk to the assemblyman so that the assemblyman can support you, because it is your life. If you joke with it, you lose it. So definitely you have to complain so that people will come and support you.
Yeah. And are there more men who are willing now to say yes?
Or
do they still prefer staying at home?
They are there. No baby na kupora to drama young man. That it has changed. So many men now want them to go to clinic.
And are there still problems that they are facing as women in society? you can think about women in the
we have. She said they have it, and I said, what is it?
So yina mal shile no changa shifta ma ko yira ma ka yi korin na ba'al ko chan kariyan she na chem tancha to pun pun a shifta ma den de nan ka shifta yi biya yin wa ma lan yina ai da ka shere agbana to gupe ka batali hada lafiya.
She said go for antenatal because they have days that they go. You talk to your landlord and then say, I don't have money. You walk to the clinic and it's far. And certain times they will not support you with money. They will just say you go, or he's not even ready to take you on a motorbike or bicycle. So you have to walk to the clinic. So it's a problem to them. And also, if they have a clinic here closer to them or chief compound, they will not have problems. They will just move in there and then come back. But it's far away.
Yeah. How far is it to walk?
Me, I am chang piezan chang yin chana doctor shan the wa ya karabe.
The wa.
It's far.
Kusha.
It's in Kushogo, the capital.
Oh.
The district capital.
Yeah. Could she say that in a sentence? Like the clinic is far?
Na yelmele totaba. Te chena shift ma mi wa de biela kuswa kara totaba.
Te chena shift. A shift ma mi wa. Na ma shift ma de biela kusha. Ate chenta zahanda.
So antenatal case they have to go to Kushogo. And Kushogo is still far from this place. You know, we got to a
the
place
chief's
here.
compound?
Yeah, just this village at the main road.
Yeah.
Kushogo is still further. So they walk to that place and then walk to Kushogo.
Yeah. Okay. Then I wanted to go to the topic of sexuality education. Or do you have other questions on the pregnancies?
Hammer?
No? Okay. We just talked about it before the camera started, but I wanted to know from her, did she know how she would get pregnant before she got children?
Did she?
If she knew, or if she got information from peers or her parents, how a woman gets pregnant before her first child.
Pagana nang de shamka nang de pua. Be akukula do te bang hungoka pagana nang de kanang de pua.
No.
To una.
Dama pagana nang de shamka nang de pua. Den na ka pa ka abjene ka ba swara ma ku to duai.
That if you don't get your menses, you cannot give birth. As for that one, it's a fact. Unless you start menstruating before you can be pregnant.
So she says she didn't know how she... And does she think that young girls now in the village know how they will get pregnant? And what to do to prevent if they don't want?
Being done no poor. Am I talking ka don kuno poor? Never be pamilala. They are aware. Bokaba me.
Bami kapa ai don differently don do. Kaba botara sheto ma.
They are aware that if a girl meets with a man without protection, you will be pregnant. Wula Tabo, I'm asking what kind of protection?
Condom.
Are you using condom?
And where does she get them in the village?
Nekaya kabnyar condom young.
Tanyale Karabera, the dash of the man, Kusha.
You get it from the clinics. When you get to the clinic and you want it, you get it. Kayofa.
The young want the Bato Quara.
Mule Quara.
The Dasam man that she shall not.
I'm asking whether if they can get it in the community. No, he said yes. They get it at a fee, but which is small. I asked him from where. Then he said from the assemblyman. That is the peer educator. So he said he brought it. It was plenty.
Yeah. And the money, is it something that young girls pay for or young boys, or is it too much?
Na chimbana dwarshama de galsia be able to darle.
The dara.
They buy.
Okay. Good. Very good. Let me think.
Can you ask her, like, she has now a lot of knowledge about pregnancy and everything else, but she didn't know when she was young, and now her children are growing up, or children with friends. Do you think it's important to educate and to give this awareness? And what will she then tell to her children?
Nanyenda mi do man pagaye toka kuldu ama pumpon be yari den yesham ka mi gba dogar be an dogar be ma an to zang le diba alzama kayen diba alzama ka ba banden fiel ne raba fiel sham wula kayen yalba
ngana zang hankal zang somba aba taadi den zema ka charam ba
wula kayen yalba
ne yalba yabare borda ba yiran yiran do yi bulote yelem borama nwa mi zo kan bora on to yo a ba chan tan ye kondom dana kay zang ma don la lan ku sa anda ma na kwa dibele pu.
That at this stage it will be very difficult to control the children, especially girls. So the only thing is the education. So she will not hesitate to educate her children, especially she will tell them to do protected sex. If a man says I love you, ask the man, what do you love me for? If it is about sex, tell the man to protect before having the sex. She can tell them that.
Okay, very good. And has she some advice for young girls?
Karala mal bangsir shelbe zok bahabondin yang batita pasara.
Mala.
Yes. Denanya dene.
Denanya te pasara ma zuna bahwanya la bace da babwa yiran yiran. Ha duwe te yinate ya no borama kazan ka borama kamare yan boama yan la'ara ma be yan borama kamana dona. Hal kan tan nga amarya. Den to chahay bo kondom shi. Kara ta tanya ko ulbana.
She's saying that nowadays men always follow women and women follow men, and certain times too it's about sex. And she will advise them, if a man says I love you, ask whether you want to marry me or it's about sex. If it is, even if it is about marriage, tell the man to protect himself so that you can give birth or be pregnant when you are ready to marry. As for that one, it's a fact. But they should also avoid teenage pregnancy.
Yeah.
That's my answer.
Do you have a wish for yourself? Does she have a wish?
I'm a manager. Ayu ne biane de tukansa bian kama am borna sa biesham biane maso e bian on bo biane sa borna njela ngon sa borna njela ngo wula ka ayu ne tirama
nga ayu ne tirama kamari ngba borna biane lama ne shi on mala juk.
Because this is such a beautiful wish, I have to ask to do it again.
Okay. Na la halab nang la den nang kara vyalma.
She can clap
An
one
yel
time.
shelma. Na fahma
Before even. Thank you. Yes.
So ala han lab ma yel an yel shelma. And the you shama bima pulma man a clinic man. Can she start?
Yes.
To ne kama an jiyan ma so kama lon ti harshen tiro man san chan biane. Wula ka ti har tirama. Your wish.
It's a hermatir man kama zankian biane. Ka ngbanyira ni ofeso wonyan walenda. Ka suhur na won kama de nan puwa ka nya ka na won ci abda wa balgatama ka nyang nune ka lihim bihma ka to chan shukurun basanan ne sanam so habiane.
She's saying that even after being pregnant and then giving birth or maybe having children, she will even wish that one day her children will look like us, and because they may be in school or educated, and then they will look like us too.
Ah, so that's a different one.
Yeah, she has added to the pregnancy.
Yeah. And one
So
last
and the yell puma many young acceptable mark of born. I said she should repeat the first one too.
Yeah, please.
to have it on the camera.
o borno gbala are na binya la yuma ngo ka borna nan puwa ka shifte to te wuma
ndi ye kamare de tuka biasa teni ndi mo onye yuma anu nchang yuma yoba nka puwa ngba mi resohre na biasa teni kan gba mai puwa kan prubiango ka shifte reje palngo kan gupente zaham isa har kula nan mun yira ando musubu.
Now she wished that one day she will be pregnant because her second child is 5 years old, and up to now she's not pregnant. If she's pregnant now, she would like to go to the clinic at Kusogo. So her wish is that one day before she is even pregnant, there will be a chips compound here in the community so that she could just rush in the antenatal and then back.
Yeah. And is there anything about sexuality that she still would like to know?
Nakarala parana do polo na duanbo polo ana male ye to shela ande borna bang be mi kaba mi. Yes. Yes, I still have to ask and probe certain. Then I'm asking what? It's about sex.
Kapadi na fora ko yiran borobe sa'atu to amari nan karinya la shift ma jera yin wo ban to nan do asase ka kondo am biane abi fora ka do ma bora de nyala to asu ka mun to ase wani zanga nan do asase ma ko zanga nan ka kana ke ta bian free ka shel kane ko min lan dala kondo ma nan ta yusra ke do na ka fulbin nan halaka bi ma ta kwan on to pa yu ma nu ayo ka na nan puwa.
She is saying that having sex, you cannot deny that with your husband because you are the only source and you don't want your husband to have deep sex outside marriage. So certain times they will ask you for it and you cannot deny, but you don't want to be pregnant. So her only worry is that she's still talking to other women and then their husband. They should come together, agree. If we want to still have sex, we can protect either through contraceptives or through condom. And it will be good if we have a CHIPS compound here, if we have nurses here, and then our husbands and we the women are aware that we have it closer. Then we can move in and then take advice and then come back, live together. You can give birth today, have sex with your man until 5 years when you want to give birth again, then you become pregnant.
Yeah.
So protection.
Yeah. Okay. I have no more questions here. Right? No.
Yeah, maybe one. Because do they also with women and young girls? Do they talk together about these issues?
Kama ambition wa yiman pasara yito dir fila zan jang an yel fila shalma kama I bordo mun tamo man yel. We do.
Yes.
Where do you discuss?
Yeah, and what kind of things?
Kama yaki laganda.
Kama dundwang yito bien. Be zama yilla. Kana chembul bola. Anto a de chan. Dama zongo na chemba ba kaye da ta dolo yiha. Obe an su kwandom kazan adwane. Kanon puwa ya anya puma.
That certain times as a family they are into compounds and they have guests in their family home. So they talk to them when they are seated doing something, house chores or other things. And also certain times when they have funerals or outdoors and you are going with your guests from the compound, you see small boys and boys calling them. Then you tell them, hey, if you go there and then that man is having sex with you without protection, you'll be pregnant. And maybe you cannot go to school again, or maybe you may not get husband to marry. So that is when they normally talk together.
Okay.
Where does the color on her hands come from?
The house and then the sex structure.
Okay.
Interview 2 met VBA voetvrouw. Can you ask her to clap her hands once in front of her face?
Just
one time. Yes. Helemaal goed. Ik heb niet heel veel accu's, maar zo dus
ja, ik ga het ook een beetje kort houden. Can she introduce herself, like name?
I am non shampoo. I am bola yule azuma la san ngila te tan ya kazana nyela yuma ngo.
Na ko yel yu shel ma hadi
ye nyine ya mbole ka bolle so pa tampen yelma te mumi akale na yele
ni la ka chereshi kanon yu ko wa
yule
asma alasa
I am Azuma Lasan. I'm from Kachereshi. That she's popularly known as Ness because of the TBA work that she has been doing. So she's now given the title Ness. So most people call her Ness.
Yeah. Okay. Did she say that in like one sentence altogether?
Yes.
Yeah. Okay. Great. Can you ask her what is the role of a TBA here in the community?
Ne paradoxo torantuma la wula aya.
Torantuma ne yesham. Dingelo banda na babahate. Ayem malpua. Wo plito kuro. Wakiran ko man shi tampalo. Nyami here. Ko da matatra bazanna. وكل مكان يروح ما نيجي نكرر نيجو بعدين دعي كمان بيعن بيدلي نيجو نيجي نكون جلسة سن مبعنا نوين دعم وتين دعم كبولم كنا نتناقض yang bakal yang ada wal kakana tinakon kana kuma saho puli katmo yetmo ka bima dinya la won tan ko ne ndo yinda na ba wote ni mo ko tan kem do tema dinya won tan ko o yen do ko do na ba kana yen yelo awula no na be yen do ne yelo ko ta shena ka tlan yela do ma
ko yul ma ka ya
do ma ko le game ka yekul kana na wono ko ne die amman die biso ko die bo ka be shelbe no zomi ba gabo shelbe no kan kama mani ana kana san shahmo zomi gabia ka yen diego le foro me lapsar kun yen gablo buango dana ta gabo nyen gole
kana zanni mani that before the similar project came she was already a TB but their duties by then and now are different. By then it was that when a woman is pregnant, you know that that woman is pregnant and you start monitoring because they did not have some kind of system that they do examination. So they monitor instead of examine. Then whilst monitoring, when it is due, they then prepare, they have their local preparation that they do. Then when the time is due during the laboring, when they call her, she will perform ablution, just like we perform ablution for prayers. Then when she gets there, she washes her hand, makes sure that she examines the stomach. And then she, being in the job for a long time, if she comes and then she looks at the pregnant, she can best tell you that it will happen in an hour's time or 30 minutes. And she will either go and then come back or she will deliver her at that time. So now her duty is to deliver children. But when the project came, they gave them training and said this time you should not deliver unless it's emergency. So this time they do more of referrals than delivery.
Yeah. So, okay.
Zamima na fuloma. Wannan wo yar na ma ka zamima ka ba ma. Ko ngo tar ma gina. Kan san mu na. An ga wo mi na. Bar ta sur mu kurjiya.
Yeah, she's given us example that this time, certain times during their delivery, you will see that when they are giving birth to a child, there's a thread that ties the baby from the head to the neck. So if you don't have the experience, you cannot untie it or you cannot cut it. So certain time they know how to do it, and then during the training too, they give them that training. So next question.
Okay. What is the biggest problem that she encounters now with a pregnant woman?
Pumpon an pa doxsoro ma bin tinya bangsam ma bulenya yi muksugo zan chang doxsoro ma polo.
Nyata mo ko zan chang doxsoro ma polo ya.
Doxsoro polo.
Doxsoro ma polo. Da man sang parla de Maria. De Maria zan te ken sang parla de kane. Kama ni yan kana ngoma, ki kya ngoma. Mbe kani bay bi la khata ta parla ma mangi ken la ton ken ba. To ni ken ton ken la. To mo kurinya ma kama pa yi welsra. Okulan to nkya. Okutala ba kiki. Na la nyela moto ki ya
She's saying that the problem now is that even though they are doing referral, certain time you refer them and then they ask you where is the means of transport that they can take that fellow to, especially during labor. When the woman is laboring, they say take her to the district capital, then there's no means. How do they take them there? For instance, if we invite them for training, she being old, certain time have to walk because they don't have means of transport. So, and you know, a laboring woman cannot walk to the clinic. So it's a very difficult task.
Yeah. And has she any idea about what she or the community could do about it?
Ati hapuna yinka chande be dem porba chanma. Ati hapuna ama tashel kama dirin nan da na songa.
Ndere nang dana songte. Dama apum mi mai parlament. Ngajire. Hali kyanta zahmu paai kullam mal pupum. Kulma ba pakira na ko mu kunya pakurle. Yermu yo kyanta zahmu. Ma sablo kar biyan bana. On kyanta zahannama woto kama man ya nakana te shinshemu. Ka bu volma nan tanya pakulango. Kan kana te yulo. Amanda ipun yer la ka shi abul ha ko te doa. Yin yel ma pumpum ma. Mun kullan kana te zaham pakulan kare ti terhetu. Yin ya betahmu doati. Nama shel nyela kon piha. Yebo shel nyela shirwa kepo. Ka ke papu bihmani ne yan be kem zahma. Na ko lere ya agwannori ya be bumbo bini. Pa shi'ab.
Yeah, I think she's talking about the training that they gave there. That to her part alone, not about the community. She has made it a point to her community members that if a woman is pregnant for the first 4 months, she should start going to the clinic. And then she does the encouragement and then she gives them the courage to go. And also, she advises them that when the time is due, they should always let her know so that she'll pay the fellow visit. And certain time what she does is that when she moves to a pregnant lady and then she realizes that it's getting to maybe the time is not due, it's left with 2-3 hours, then she quickly advised them to move to the hospital, by which time she can still ride a motorbike or a bicycle.
Yeah.
But when it is due, they cannot put her on a bicycle or a motorbike. So this is her advice to her community members.
Yeah.
Ka tama mama san chan lor polo na yanka lor din chan ma wula kayan yele wula kiyan nan ya shere be gun ye soya. I'm proven to see the community itself. What they think.
De pompo den non shengo pa dom to manguna yinkul yel mama man kulan kyante non pa biela ko doi. Yirna yen yabta mo doati.
Boka bien zo tai.
Den kan to harana ma. Ni na ban ngoni mu. Hal ne shi ma yen do hatta. Karnyela kummal su ko do anyela to. Yen kem ka ko baro. La pa ma ngira nu ko yen ndadi pa so ma. Yiko ken fa die ba men ngon bala ngon yambe kan to anya yelo no del bana fa ni no be dire fa o tenon ko ba betenon ko ba ma kan chawo ni wa ko ni le kana go yishe ma nan bo ko yen do am
and what other I had 2 more questions I wanted to ask her, but we can do that when we have the records so that we can put it all together. It was how she involves or or together with the community?
So we can go ahead.
Okay.
Yes. If
So
you
you
can
have
clap
to
one
film
time.
man. Bahama nu zosa tanga biara anywa dede
Like on
Ingo,
the forehead. Bit higher. So
Bahama
you see it.
duhmele zosa
Yeah.
Okay.
Okay. I think we didn't record the answer about what was the biggest change that she
we didn't. So we start from there.
noticed.
So you ask.
Yeah. Okay. What is the biggest change she noticed in the community?
Should I go ahead? Nangwaya ne akpambu pune tiyan lab me yel to ma ayane benti ya bansama na bole tare ayango polo dama akal den shanga den yipa tare bole tare bo
ni yanda tagaya ma ya
na
kama biara mini asba ma ka pawolna ya ban hamma da kan to ni tin yanda kama shi kullu malaka ma walni lala kana wanta sukuna wasu na mana da gombi ma da man gombi so ko kullu bara karni wannan din an ma
that there are a lot of changes. For instance, in Ghana, there are a lot of changes. For instance, the referral system is now there because we taught them how to refer people and then what they should do next. They are doing it. And because of that, it has actually reduced the mortality, or what do they call the rate of stillbirths. And then because of that, actually